alaikum. I'm Dr. Sindhu, and now I'm going to make video on data gathering from the patient. So first we'll start from history of present illness. Okay, so in history of present illness, you have to explore details of the symptoms, ask probing questions about each symptom described by the patient, then ask a close-ended questions to and drive a specific information. Okay, consider 3 or 4 differential diagnoses in your mind, and then ask about each of the considered differential diagnoses. Actually, this will help you in ruling in the provisional diagnosis and ruling out the other differentials. Okay, and ask a few questions about red flags of his or her condition, and you will not miss any possible serious diagnosis, and you will be considered a safe doctor. Okay, so you should be able to ask a few red flags questions. So it was all about history of present illness. Now come to the past medical history. So in this part, ask for any history of a similar illness in the past. If there was any hospitalization in the past, if the patient has any history of high blood sugar, high blood pressure, heart disease, lung disease, joint diseases, or any respiratory. Okay, so related that. And now come to the personal history. So in personal history, ask how is your sleep? Do you have a sound sleep? Do you wake up feeling fresh? And do you have difficulty going to sleep? Do you have interrupted sleep? And try and elect any form of sleep disturbance relevant to the suspected illness. Okay, and you can ask about what about your appetite? Have you recently lost your appetite? Are you hungry all the time? Do you binge eat? Do you tend to starve? And about habits like, do you smoke cigarettes? How many cigarettes in a day? Have you ever thought of quitting? And what stopped you from quitting this habit? And about alcohol, ask about, do you drink alcohol? How much? How frequently? Any intention of cutting it down? And then what is your diet like? And do you like to exercise? What kind of an exercise routine do you follow? And how many minutes in a day do you exercise? And then you can ask about what about your mood? Do you feel happy, sad, excited, angry, or energetic? Okay. And then ask about social history. Um, First ask if you are married. Ask about marital status, and then ask about do you have any kids? Okay. And then how are the things at home? What do you do for a living? And then how are the things at workplace? And did you have kids? How many age of lost born in obs and gynae cases? Okay, in particular, and how are things at home? Um, and how are things at work? And then ask about the family history. In family history, ask, is there any major medical illness in your immediate family members, like high blood sugar, high blood pressure, any heart-related problem, lung disease, any joint-related diseases? Okay, and after that, ask about drug history. Are you taking any medicine regularly? If yes, ask which medicine, in what dosage are you taking it? Okay, and ask about, do you have any allergies? Okay, and after that, ask about sexual, menstrual, obs, and gynae history. Okay, but always forewarn the patient before asking sensitive private matters such as sexual history. Maintaining confidentiality is very important. Okay, so for example, you can say, now I would like to ask a few personal and private questions, but rest assured that whatever you share with me will remain confidential between you and me. Is that okay with you? Is it okay if I ask a few personal questions? Do you mind if I ask a couple of personal questions? Is it okay with you? And patient will mostly say yes. You may proceed. To make it a point to thank the patient for trusting you. Thank you, Mr. Blah blah blah, for trusting me. Okay, so it's like that. And after that, ask travel history. Okay, but ask travel history only if relevant. Okay, uh, if a patient presents with specific sign and symptoms like any discharge, any diarrhea, or any prolonged travel. Okay, so it's like that. And then about red flags. Red flags means potentially serious cause. Okay, so therefore it is important for doctor to ask questions that elect red flag signs in a patient. Okay, and having a red flag symptom or sign indicates that the situation is not simple. For example, weight loss in a short span of time may indicate cancer or TB. Similarly, loss of blood in the stools could be an indicator of colonic cancer. Okay, so for example, um, these are the red flags. And now I'm going to give some examples of red flags are central chest pain or exertion, headache, which is persistent, increasing in intensity, wakes the patient from sleep, and is present in the morning. Okay, and bleeding from any part of body, postmenopausal bleeding, and neck stiffness with fever, a red swollen joint with high grade fever, sensory motor deficit, suicidal ideas are planned. Okay, if a backache is of short duration and limited to the lumbosacral region, it most likely is simple mechanical backache, but if it radiates to one or both legs, it is considered as a red flag. Okay, so you should be aware of red flags. Okay, and after that, about illness, what is the impact of this condition on your life, or how this condition has affected your life? Okay, and then about the idea, ask the patient, what do you think you are suffering from? Idea means what is the patient's concept of his disease, in his her opinion, what is the cause of his or her symptoms. After that, ask about the concern. What means what is the patient most worried about as regard his symptoms? Okay. And so, for example, a patient complaining of headache may relate his headache to brain tumor because he has seen or heard of another friend or relative having headache, which turned out to be due to a brain tumor. So the patient may be worried or concerned if he has a brain tumor or not. A patient with simple hemorrhoids may think he has bowel cancer. Okay, so you should exclude all these things. Okay, and now let's talk about the expectation. So expectation means what the patient is likely to get or get out of his or her consultation with the doctor. So the doctor may ask the patient about his expectation from the consultation in the following way. What do you expect me to do for you today? Asking the expectation is very difficult in South Asian context because almost all patients expect relief and cure and trust the doctor. Okay, so you should have skills to deal these things. Okay, now let's talk about the non-judgmental attitude. A doctor should not judge a patient's religious or personal practices by calling them right or wrong. For example, if a patient comes to you after having contracted a sexually transmitted infection, a doctor should not condemn him or her for acquiring it through multiple partners, visiting prostitutes for men and prostitution for women, for not being faithful to the matrimonial partner. Okay, a professional obligation of a doctor is to advise safe sex, for example, suggest using condoms for a subsequent intimate relationships. A doctor is not supposed to impose his or her personal beliefs on his or her patient. Okay, and so no judgmental attitude. Now let's talk about empathy and sympathy. It is important to understand that empathy and sympathy are two different emotions or feeling. Okay, my sympathy is the feeling that you care about and are sorry about um, uh, someone else's trouble, grief, or misfortune, etc. And empathy is the ability to emotionally understand what other people feel, see things from their point of view, and imagine yourself in their place, essentially. So it is putting yourself in someone else's position and feeling what they are feeling. So it is very important for a doctor to express sympathy and sympathy towards his or her patients as appropriate. And it should be a doctor's second nature to show empathy promptly, whether she sees a sad or worried patient. It should not appear as an artificial gesture just to impress the examiner. You should be natural. Okay, a doctor should respond immediately to an emotional signal from the patient, whether verbal or non-verbal. Okay, and empathic nonverbal responses could be like nods, gestures, touching or patting on the shoulder, back, offering a tissue paper if the patient is crying, a glass of water if the patient becomes quiet. Okay, and there are different ways in which a doctor can express empathy. Some examples are like if I had been in your shoes or position, I would have felt similarly. You can say like, I can understand how difficult it must have been for you. And another way is, it must have been very unsettling for you. I can understand it. You are going through a difficult time. You can say like, you seem to be a bit upset. And sharing helps. So let me know. I'll try and help you out. Okay. So these examples of empathic statements are given to help candidates to save time and finish the consultation in time. Okay, and doctors are advised to keep making their own list of questions or sentences so they may not feel stuck or handicapped during the exam. Okay, so they should have strong reflexes on asking these questions. So now let's talk about the patient-centered approach. A family physician is an advocate of patient's mental and physical well-being. So it is important for the doctor to explain and discuss the patient's condition with him or her. The management and planning should not be imposed upon the patient. In fact, patient preferences, social and financial standings, and patient safety, his her lifestyle and concern should all be borne in mind and the management plan customized accordingly. A doctor should have a healthy discussion with the patient, giving him or her freedom to express himself or herself. Okay, so it was all about data gathering, and in next video I'll start from bio psychosocial. Okay, I start